COVID-19. So welcome all of you YouTubers. I've got Instagram Live and YouTube Live to detail updates about the coronavirus. And holy cow, a lot has happened. I think the first time I reported or shot video with educational resources to our YouTube community and then here on Instagram was at the end of January. And I think we had one case here in the US. Now we have thousands. That are actually being tested even today. It is literally crazy. So it's impacting all of us. And so welcome to all of you. First, I want to make sure that you comment down below. Let me know where you're tuning in from. And I've got pen and tons of paper. I am watching the live chats. If you have questions about COVID-19, the coronavirus, what to do, how to equip your body, your families, comment down below. I'm going to be writing them and we're going to have a discussion. And this is totally free flowing. And hey, Cleveland, we've got Stephanie Ann Marie and hi, Whit D over in Georgia and KY Denman. Welcome everybody. I'm so honored to have all of you join me. We have about in total, it looks like 100 plus watching thus far. We've got Arizona, Texas, any international viewers, let us know. So, let's talk about the coronavirus. It is here. It's in the US. It is all across the world. It's impacting all of us in a multitude of ways. And if you don't feel like it is impacting you right now, it will. So I want to really cover resources for you, how to equip your bodies, equip your immune system, which is our number one defense. Hey, everybody, we've got Israel, we've got Trinidad. I saw we have somebody in the UK, on Instagram, Finland. So the goal here is to really just chat and answer questions. There's a lot of misinformation. There's a lot of overwhelm. There's a lot of fear. There is a lot to take in. And this is moving so quickly, it moves like a virus. And that is what we're kind of dealing with from a medical perspective. So first, I want to kind of tell you where we're at here in our personal life. So many of you know, Brian and I have been planning our wedding for 14, 15 months now. And the date that we originally chose, it's actually the second date, but the date we were like going for is next Friday. So 6 days away. And as of yesterday, things went south really fast. And luckily we are moving to a brand new date. We're pushing it out. So that's my personal impact with this. It's quite a serious situation. We all have individuals in our lives who have compromised immune systems. Many of you are aware Brian has a very unique, very bizarre autoimmunity as it relates to his platelets. And so his body attacks his platelet levels and his platelet counts dive if he's exposed to any type of issue. And so he's not very open about that, but that's what we're dealing with. We have parents and we have loved ones with autoimmunity. We have friends that have compromised lung capacity because of asthma. And we all have individuals in our lives like that. And so what I want to do today is talk about where we're at right now. I just pulled the latest and greatest details for you, but also I want to start to share with you what I'm doing and what I'm recommending for my patients to equip themselves with and really some choices, because at the end of the day, here, at least in the US, we are not in any type of mandated quarantines. We're not in any specific mandated, like stay in your homes, don't go out. But the reality is that we have to be the drivers and we have to make the decisions ourselves for the interest of our own health and the interest of our and well-being of those that we love. And if you are a business professional, you might have to make decisions that might be a little different than your employers. And if you're a business owner, you're going to need to be making decisions. And so yesterday's example with Brian and I being very decisive, very immediate with our response, reaction, reactivity, and working with all of our wedding vendors, which by the way, they are all amazing. And I posted a link over on Instagram. You can see everybody that's been fabulous. Only one vendor, one hotel was quite snarky. And so we'll probably be taking our business elsewhere. But at the end of the day, we have to be armed and dangerous. So let me give you some updates, and I'm seeing some questions. So I'm writing down questions too. Queen 2, asthma. Okay. Hey, everybody on Instagram, stay with me. I'm going to be detailing a whole bunch of the details here. And first, we're at 500 cases in New York. I think New York has officially become an epicenter, at least on the East Coast. And New York City and New Rochelle seem to be the biggest hit right now. So if you're in the New York City or New York area, comment down below. Let me know if you guys are there. And then Florida, because I'm a Floridian and I have family and all, that's where our wedding was planning. We've been monitoring that. There's 3 deaths thus far. Yesterday, I think we had 2. So we've had another one in less than 12 hours. And Florida has really gone up in the cases. We're at 70 cases there. Georgia has also had that exponential growth. The county we live in, there's 8 individuals with the virus. In our neighboring county, our next door neighbors, our fence line, and I'm in my home office studio. There are 8 individuals. And so what they're saying is that, I think I reported last Friday, data and information that we were all told from the CDC that there'd be 75,000 test kits, that we'd all have access to it. That has not been the case. I have friends in the healthcare industry. One of my bridal party members, her husband's an ER doctor, and so he's on the front line in Florida. And what has happened and what's challenging with the state that we're in is that people aren't getting tested that need to get tested. People are presenting with symptoms that may very well be coronavirus-related symptoms. They might not have now had to travel to any of these areas. You know, the World Health Organization has recommended, you know, that we test for folks that have had exposure to China, South Korea, the hot spots, Italy, Japan. And the reality is that now, because of the spread and the kind of growth of this, we are beyond that. And so that communal spread that I talked about in the last video, we're at this point, and it is now forcing the healthcare communities to potentially reassess the testing. And I don't think we're there yet. So for instance, my friend, the doctor in the ER, they are only testing you if you meet certain criteria. Well, the reality is that there are a lot of, potentially you all and us in our communities, with this exposure, we could be walking around asymptomatic and carriers, breathing and, you know, kind of having the respiratory particles impacting everybody in our everyday lives. Within 6 feet is our kind of contagion. We have a situation where we've got to make decisions. And so, for instance, we here, and now that we're not doing any wedding planning, we're kind of going into hunker down mode in our house. And so I went into planning mode kind of preemptively, knowing we would be out of town for our wedding. And so I'm going to share with you a lot of the stuff I've gathered. I'm going to share with you our plan of attack. I also am going to share, at least on YouTube, I'm going to share with you a free download. And Instagram, just DM me if you guys want this. I created this a week ago. This is my antiviral checklist. It's anti-corona. It's multiple pages. So it's got some details. It's got a checklist. We have a shopping cart. YouTube, this shopping cart is an active link in the description box if you want to go over there. Our inventory online is changing just every day. Things are going out of stock, but we have a lot of items on this list available in our online store, which is where you want to be. You want to be online shopping. Got links on this. So this is a free download. So let me know if you guys want it. YouTube is live here. I've got Instagram. I have my phone over here. The link is in the description. So I want you guys to download this. It's totally free. This is going to equip you with a lot of the details you need to stay equipped, armed, and dangerous, to help your immune system be armed and dangerous. And at the end of the day, we have a few defenses. Our number one defense against a pandemic like the coronavirus is a boosted, strong immune system. I want to address a little bit in this video, and then I'm going to be preparing very specific content for any of you who are immunocompromised. And so it will help me if you comment in the description box below what autoimmunity you're dealing with, because I'll start to pull that content and really really create armed and dangerous information for you so that you can be helpful. So, or it's helpful. And by the way, I'm drinking my bone broth, which is a great defense mechanism for boosting your immune system, supporting your body, giving your body all of the micronutrients and minerals you need. So let's just dig in. Our number one defense is your immune system. The second defense is social isolation. And I know that sounds really crazy. I am going to be a little bit bold here. And I feel like I've always been on the curve, at least here in the content communication. I'm going to recommend that anybody who has any type of compromised immune system, if you are recovering from any type of illness, you've had radiation, you've had cancer, you've had surgery, you just always get sick, you have, the cold and flu very frequently, stay indoors and stay away from as many people as you can be, or stay, just really self-isolation is key. This is what I'm going to call a self-imposed quarantine. Just limiting your exposure is going to be really helpful. It's going to be very important to help support not only your immune system and minimizing your exposure, but it's also going to help other people and help us really minimize the curve. There's this kind of community growth curve where sometimes the outbreak and the expansion, we have a 10x, 20x exposure, and it just explodes very quickly. So one person times 20 times, that one person's times 20. And it is a multiplier, an extreme multiplier. And when we limit our exposure, that's where we can start to get containment. That's where we're seeing countries that have had better reactivity and decrease in the quantity of folks who've had this. They are safer. So making sure that we limit our exposure. Oops, sorry guys. I should have put my phone on to not be disrupted. But anyway, what you want to do is you want to be safe and you want to stay close to home. So with that being said, I don't know how many of you have kind of gone out to get supplies. I know that there's this toilet paper shortage. Everybody's freaking out, like, what the world? It's not like, cholera or any of the anti-diarrheals, but it's literally something that can very well be, it can be very impactful it could be very impactful to our psyche. So I will tell you this, when you go to a store and the shelves are gone, you go into panic mode. And I spoke with one of my bridesmaids Thursday night, and she was like, I'm in the parking lot of Publix, which is one of our supermarkets in Florida. And she's like, I don't even know what to do. I don't know what to get. I'm freaking out. She's starting to have this anxiety, and it's very common. And I told her, I said, just treat this like you would a hurricane. Floridians, we are from Florida. We deal with this. We go into preparation mode, and that's very similar. Now, there are many of you who might not have any inkling of preparing for an oncoming disaster. This is something that we can't see, and it's sometimes hard to mentally conceptualize what an outbreak or a pandemic looks like. We've really never lived through this. Brian and I were like, this happens once in a lifetime, and it's happening to us. And so the awareness and being kind of cognizant of what to do, I just go back to, it's like a hurricane. And so when you go to a store and the shelves are empty, you go into like panic mode. I don't want you all to be panicking. I also want to encourage you to limit your exposure. Now, I will tell you this, like if you go to Amazon, they're out of toilet paper and paper towels. One of the reasons why toilet paper is out is apparently one of the manufacturers, and I don't know if this is in China or any of the other Southeastern Asian countries, but one of the main manufacturers is now manufacturing masks instead of toilet paper. That will protect us. That does leave us in a little bit of a bind in terms of getting toilet paper. But, when in doubt, you can use other things, not your paper towels, but like tissue paper, the tissue Kleenex. That will be a better use for toilet paper replacement. But don't fear. There are places where you can order. We actually ordered our regular kind of requirement of toilet paper and paper towels online from Office Depot. Locally, it's getting delivered tomorrow, and we did not have to go into a store. So there's some ways to work around that. And that's what I really want to encourage you. Yesterday, I think, was when things literally like the shit hit the fan, so to speak, pardon my French. But I think what happened was people literally, because of the, all week it's been crazy, but then yesterday, the declaration of a national emergency and us seeing just increases of these cases and some change in governmental dialogue to us on Thursday, it kind of caused people yesterday to go to Sam's Club. And I saw on Instagram, I saw on Facebook, I even saw a video on YouTube about people being in these long lines. And like, that's not where you want to be. You don't want to be in the masses right now, because right now we don't have enough people being tested. So we don't even know if people are in these lines and they're carrying, and that just really increases exposure. So online ordering, online shopping is going to be key. And then also pantry items, you can start to gather items. Amazon Pantry, they're connected to Whole Foods. They've got a lot of stuff still in stock that you can easily order. With that being said, I want to talk about some of the transmission information. We are gaining more information. It's kind of coming every day at us. And we have Jeanette Lynn. Hi, Jeanette Lynn. She said, don't panic, but pray. And I think take action. Let's be calm. Let's be cognizant. Let's be decisive. Let's be very smart for ourselves and others. I think that's going to be my biggest recommendation in terms of what we need to do globally. So the big thing is transmission rate. So, the questions that came through on Instagram from a lot of folks was, okay, so I'm not going to stores, but I'm ordering online and I'm getting my mail. Should I be sanitizing my mail, and should I be sanitizing the cardboard paper that comes through? So what they've identified is that the lifespan of the virus on cardboard is 24 hours. So that's some really newer research that's come out. What that means is, let's say you get an Amazon package, and and I actually just saw the delivery guy drop something off about 20 minutes ago as I was prepping for you guys. He dropped off an order. I just leave it outside. So I've been leaving all of my boxes outside for 24 hours, and then I bring them in the next day. Nobody's going to steal them. It's mostly wedding stuff, to be honest with you. But the big thing is that we just be really cognizant. So you can also use, some of the kind of cleaning wipes if you do have them, to clean off, mail pieces. But again, 24 hours is that kind of time frame. Metal and materials that, like shopping materials, there's a little bit of a discrepancy there. I've seen 2 to 3 hours, and I've seen up to 2 to 3 days. But definitely cardboard is one of those things that if we do online ordering, we're pretty okay. I've seen a lot of commentary about school closings. What do we do in the event that we are in quarantine or we have to stay home? And this is something that I think we're all going to have to deal with, is what do we do with the ensuing economic situation? We won't be necessarily going into work environments. We won't be shopping or limiting our shopping. And then we have small business owners like myself and a whole bunch of other restaurateurs and event planners. Like the wedding industry is getting rocked down in Florida, and I'm sure in all areas. As individuals like us, we're seeing our participant numbers decline, and that's such a huge preparation, lots of time and money and planning, and it's just crazy. So let me take a quick little swig here, and I'm going to share with you some immediate resources and start answering your question. I'm excited. We've got about 300 of you all online. I think this is our biggest live yet. And if you guys look behind me, at least on YouTube, this is my natural health resources set, and this is my wedding channel set, which that's going to be really, I'm going to be doing a lot more work on that. In Instagram, you can see that's my wedding set. So I shoot wedding videos over there. Okay, so let me share with you some things that I've had in my arsenal. And then I picked up, and you can order online. All of these I get in my online store. And again, some of the places that will deliver, this is where you want to go. Okay, so first I want to talk to you about Host Defense. It's called My Community. Host Defense is a powerhouse that's grown here in the US. It is an assortment of immune fortification, botanicals, mushrooms, extracts that are powerful. So let me list some of the items that are in here. It has maitake, chaga, reishi, cordyceps. It has oyster mushroom. It has birch, it has turkey tail, it has lion's mane, it has amado, and then it has a whole assortment of other mushrooms and just extreme immune boosting. This comes in a liquid dropper, capsules, and there's a spray. This is what I'm recommending. I'm getting a lot of emails from patients who have lymphedema, who also often deal with cellulitis, and they're like, what do we do? What do we have on board? How do we equip ourselves? So my community is definitely one of these I'm taking on a daily basis. It's really good and powerful for folks with autoimmunity because it won't speed up your immune system. And that's something, these are immune modulators. Autoimmunity, you want to be dealing with immune modulators versus necessarily immune boosters, because the autoimmunity, you already have a heightened immune response. And so we want to modulate and help support that immune response. So that's going to be key. So the other thing, I had this is a little dirty because it was in one of my bags, but this is my travel sanitizer, the everyday sanitizer. If you guys have hand sanitizers, do equip yourselves with these if you are going out. I have become very aware as I was running around Monday and Friday, or Monday and Thursday. Those were the days that I was out and about. I became really aware of stores that had access to the hand sanitizing stations. And the pet store did not, and it kind of freaked me out, but we go there a lot, and they have cat adoption area, and we always know they have hand sanitizer there. So I actually went there, grabbed a whole bunch of hand sanitizer, walked through the store, got to my the shopping cart, and like really hand sanitize. That can be helpful in an interim basis, but don't rely on just hand sanitizer or even like the wet wipes to eliminate the virus. The best course of action is to actually do good, solid 1 to 2 minute scrubbing really well. I feel like, we've been training Gabriel and teaching him on how to wash his hands. Hand washing is going to be absolutely crucial everywhere. And then avoiding touching your face, which I know is very hard. A lot of times, like when I'm out and about, my hair gets in around my mouth. These are things that are just really minor. But if you are out and about, you want to make sure that you've got stuff, have it in your car. I started thinking about like, where are the touch points and what type of transmission could we be looking at? We could be looking at money as a transmission point. We could be looking at the ATM machines as a transmission point. We could be looking at the gas station, the little touch pads, because your fingertips are definitely transmission points. We could be looking or considering like even the gas handles. Those are things that we don't always think about. We think about the door handles, door handles to the bathroom, even the different, apparatus hardware. So we have to start to think about, okay, what's the exposure? That's why staying close to home is best. And then equipping your homes is something that I actually have on this sheet. And for all of you new joining, because I know we're spiking on our numbers, this antiviral checklist on YouTube, it's in the description box. This is a free download. It's multiple pages. On Instagram, just DM me and we'll make sure we get you that link. Okay, so I'm going to start answering your questions. Oh, let me share with you one other thing. It's okay, Brian. The other thing that I use religiously is, and it's hard to see here, my lights are really bright. The super lysine. So I'm trying to show my YouTube folks. Super lysine is an immune response. This is by Quantum Health. I've actually carried these folks since I opened up in 2008. They're an herbal tab, and Sprouts, Whole Foods, Amazon, our online clinic has these. It's a really good product. It's this little tab. Oops. And it's a combination of vitamin C. It has calcium, L-lysine. It has garlic, echinacea, propolis, licorice. And it is just a really good solid immune booster. Propolis is bee pollen, derived from bee pollen, and the propolis is a very good immune booster. You can cook with that. You can put that in your smoothies. That's fantastic. And the L-lysine or the super lysine, I always recommend this for folks that might be dealing with weakened immunity, kind of propensity to colds and flu. And then also the lysine component in here is very good for any of the herpes outbreaks. And that could be also shingles. And, if you are susceptible to shingles or any of these other kind of common recurring outbreaks, that's definitely an indicator your immune system is going to need some support. I did have a question. I saw a question here. How do you prepare your broth? I actually buy this. This is a frozen food. It's by, I'm trying to think of the name, but I got this at Sprouts. It's a keto broth. It has a lot of butter. Why it's creamy looking? There's a lot of butter and MCT oil in it. And this just happens to be something I've been ramping up in wedding preparation mode. I've been drinking a lot of bone broth, trying to really enhance my collagen and just boost my mineral content just for good hair. I mean, I don't know if you guys can tell. I feel like my hair is really growing in really well. So this happens to be frozen. I do make my own bone broth, but more recently, just timing wise, I've been buying the frozen. And I found that frozen tends to be a much better, more abundant, gelatinous consistency, and that's where you get the collagen. So if you're not getting substance at the bottom of some of your, non-frozen items, or even like the powder, not that they're not bad, but this, I really like this. And it's got a really nice buttery kind of salty flavor. Okay. So I'm gonna just go down some questions. I'm gonna go back here on YouTube. By the way, YouTube, we're on Super Chat. So if you feel like you want to make a contribution, please feel free to do so. I always appreciate folks supporting my channel. Super Chat is on, and I will shout you out if you do make Super Chats. Okay, so I'm going back to some questions. I'm gonna start with YouTube. I'm gonna kind of go back and forth, YouTube, Instagram. So start firing away at me. Okay, so Evelyn Aragon said, how do we build up our immune system? So this is a very kind of broad question, but the big thing is, one, don't stress. Stress really heightens our immune system. So when we feel like we're in this panic mode, it can decrease our immune response. So stop and breathe, do self-soothing activities or things, self-care that can calm your body down. Make sure you're getting a lot of sleep. Make sure you're eating well, you're getting good micronutrients, you're getting your minerals. Those are going to be good things just globally to boost your immune system. Don't skip meals. Just really try and limit just that stress on your body. The other thing that is crucial is just adding in homeopathics, adding in botanicals. Elderberry is a really good immune booster. So is my community. Mushrooms are very good immune boosters. You can cook and eat with them. I always prefer food first when we're making those choices. And then, going through the list of multivitamins, micronutrients, making sure CoQ10 levels are up, vitamin D, increase on that, zinc. Those are all very good active immune boosting methodologies. Okay, so Instagram. Let's see, I've got lots of questions here on Instagram. So I'm going back on Instagram. It's a little hard. I have to go to my phone. Okay, so first question that I see here is, thermogenic. Can you imagine how thermal imaging may help spot those affected? Potentially. I mean, I haven't seen any studies or data about thermal imaging. I know right now, CT scans are where we are really assessing the extent of the lung damage. And that's really the big thing. The impact of this virus, it's respiratory. And so any way that you can boost your respiratory or enhance your respiratory health, like enhancing cleaner air quality at home, salt therapy, salt spa, or even halotherapy, having the salt lamps, those are all going to be beneficial to our lung capacity. There are botanicals like mullein, comfrey's very good. You're going to start to see if you guys are prone to any of the respiratory challenges. One of the things that I would advise you to do if you are going to start ordering things, again, I recommend ordering and not going into public, grab things that will be impactful for like congestion. Sore throat's a big thing, headache and fever. Any fever above 101 is something to be cognizant of and to start to evaluate your symptoms. The cough and kind of congestion tightness, difficulty breathing is the more common. That's where we start to see those symptoms where those individuals should be getting tests. The secondary infection is pneumonia. And so that is what is deadly about this. What is deadly is that the virus, its mutation, its incubation, its impact in the lung tissue, it's actually changing the cellular makeup of the lung tissue. So CT scans give them a very specific look. Now, most of us here in the US are not really cognizant of CT scans. Many of us may or may not have had them, but like in China and some of these other countries, their frontline response in screening is actually, they have these portable CT units and they're running 200 people through them at a time. That's significant. Are we at that level here in the US? Hell no. There is no way a hospital would be able to scan that many people. So, we're going to have to be really, really cognizant of just supporting and boosting that lung support. Mullein is one of my favorite herbs for enhancing lung capacity. Oh, by the way, for all of you on YouTube, if you love this, please give me a like and hit the share button. Let's post this to all of the friends and family you know. Let's get this info out there. Hit the share, post to Twitter. I think you can post to Facebook as well. Give the video a like. That really helps the algorithm. And what else was I going to say? And answer, send me questions. Okay, so I hope that answered that question specifically. All right, so let me go to YouTube question. Queen21, I want to know the history of it, more about it, how it affects asthma and PrEP if it comes to my town. Okay, so Queen21, it is coming to your town. It's not a matter of if, it is coming. And I don't want to be doom and gloom, but I want everybody to be aware. I want all of my viewers to be equipped. If I can have any type of impact on keeping you healthy and well, keeping you out of the healthcare system where you're going to have greater exposure, higher risk, that's my duty. And it's my privilege. So one, it is coming. And I know that sounds like, oh my gosh, it's this like silent thing and it's a monster. And I mean, there's a lot of fear that comes with that. I get it, but I want to be realistic. We want to be pregnant. I'm going to be a pragmatist and realist here. And usually that is not my MO. I'm a little bit more of an idealist, but in this situation, we have to be pragmatic and we have to be realistic. As for asthma, that puts Queen21 and any of you viewers, any of your loved ones in a category where you're at a higher risk. So if you have asthma or have any type of decreased lung capacity, lower oxygen levels, COPD, any of the kind of bronchial stuff, this is what I've been recommending to my patients. I recommend that you make sure you have all your scripts, your inhalers, you have all of the necessary items, any breathing treatments. A lot of folks have nebulizers. Doctors are being very preemptive and proactive and calling in extra orders for your medication so that you can self-treat at home. You're safer self-treating at home. So asthma, limit, and unfortunately, like we were outside earlier today. Brian and Gabriel are running around doing a whole bunch. It's beautiful. They're outside, and that's where we're kind of staying in our little zone here, our like 3/4 acre zone on property. It's allergy season. And so in a lot of places, spring is kicking up a lot of allergies. That will put people in an even further compromised immune state lung-wise. So that's what I'm going to recommend for you. Preparation is get all of the scripts, get all of the equipment that you need, and ask, like, if you feel like, oh my gosh, I might need to have some oxygen or whatnot, ask your doctors. I mean, this is where, if you have insurance coverage, your doctors are willing to work with you, get equipped. Okay, so Instagram, can you hear me? I'm hoping, because I was looking at all the questions that you guys could still hear me. So somebody comment and let me know. Okay, so YouTube, I'm going to answer a question from TJ Zachi. Says, hey, can you advise me? My mom has cancer and is going through radiation, as it is her white blood cells are very low at the moment. What would you recommend to boost it, especially at this time? Okay, so that's an excellent question. What I would say with anybody who is going through cancer treatment, work very closely with your cancer docs. I know a lot of folks are in this situation where, they're still going into the outpatient centers and they're doing their chemo treatments. One of my matron of honor, her sister is going through that right now every Friday. The hospitals are taking a lot of precautions, and it may very well be something that it might, who knows? I'm just putting this out there and anticipating, depending on the growth of this, it might halt some of the kind of degree of timing for folks. And we may even see folks ending up moving into like a home care, where there might be home care specialists that come in and do the, the connections to ports and whatnot. So for an instance like that, every cancer case is different, and every cancer medication or protocol is different. And it becomes really tricky because a lot of, like, for instance, this one individual I referenced that's going through cancer treatment, she's in a trial. Well, they're really restricted. They can't introduce outside things like botanicals or homeopathics. And so it gets a little tricky in terms of being able to respond to that, that situation. So at the end of the day, food first. I think it'd be great for your mom to start consuming bone broth daily. I think it would be great for her to enhance her vitamin C levels, her vitamin D levels. A lot of times they are going to be doing blood draws, have them test for her micronutrient levels. Just throw that in and see, because she might need to enhance, not just vitamin D, but zinc levels and selenium and all of the other micronutrients. I think at the end of the day, fortifying our immune system and fortifying our bodies, we can do that through good, healthy, whole foods. We can do that through good herbal protocols, like implementing good sea veggies, so spirulina, and increasing our kelp, boosting our thyroid, enhance our thyroid health by helping boost that immunity, doing lymphatic exercises. So this is really big. I actually had a list. I kind of am escaping into work to mourn the wedding right now. So I went through and made a list, a content list, questions that I've seen come in, and questions I know I would want answered if I were dealing with a lot of typical conditions that you all deal with. So I wrote down a list of video content I'm going to be putting out. So when we're done with our live, I'm going to be putting out more content. And so I'm going to be shooting over the weekend. I'm homebound now. I'm not seeing any patients. I've canceled all of my clinical in-person patients. So you're going to probably see a lot of me. And I'm also looking at going live 9 a.m. So at 9 a.m., at least weekday, I want to kind of give everybody updates and answer questions. Hey, Michelle Grace, I saw you're on here. I hope you're still on here. So with that being said, I know one of the things that I think will be most impactful is going to be just really, really boosting, lowering the stress level that we all are dealing with, and limiting your mom, because she's dealing with cancer and is in this treatment, limiting her exposure. I would recommend that she go into as much of a self-isolating situation as she can go into. And that tends to be often, depending on the cancer patient's condition and the extent and impact of the chemo, we want to do that anyway. Chemotherapy really does put a wrench in immunity, and some of that's on purpose because we are trying to kill the cancer cells. So it's a little bit of a tricky situation, but I hope that answered your question. And friends, thanks for tuning in, everybody. We are at almost 340 viewers. So thanks for everybody taking time today. I really am very concerned for all of us, and I really want to use this as a format to reach out to all of you. So Nancy DeGray says vitamin C will help your immune system. Absolutely. Queen 2 said, what's actually causing the death? So it is complications to the lungs. The pneumonia tends to be the secondary condition that is compromising folks' immune system. And I've got hair here stuck on my face. Okay, so I have Isa on from YouTube, and she is from Italy. Isa, comment and let us know how you guys are doing. How's the quarantine going? And are you feeling like you were well prepared? All right, so on Instagram, some questions came through about, let's see. Okay, we're just getting comments. Okay, Instagram, if you have any questions, send them over. So I had Abba's daughter 46 ask, what is your opinion about use of mushrooms for those who have had issues or currently have issues with yeast or fungus? That's an excellent question. So using these types of mushrooms can very well be impactful for addressing some of the yeast. So yeast, like bad bacteria, candida, is not the same yeast or fungus as we would see in a mushroom. So it's that term fungus we kind of use loosely, but these are good bacterial fungi, and like candida and the yeast, that's an unhealthy bacteria that can minimize our good healthy gut immune system. That's a player. So they're two totally different things. I have Shelly Rams 123. I've heard people are dying from heart failure. That is correct. One of the things we call it the golden triangle. One of the things when folks come down with or are impacted by pneumonia, the lungs, heart, and kidneys, it's this golden triangle that gets impacted. That is why they have listed as risk, candidates of risk factor are folks with diabetes, folks with any type of heart condition, heart arrhythmias, heart failure, congestive heart failure, folks that might have had a heart attack, they have stents in, they might be on some of the different medications. There is that golden triangle. When the lungs get compromised, it compromises the fluid levels that then in turn impacts the heart. And so it's this really intricate trio, if you will. So I'm seeing a lot of likes to that comment. As a secondary infection in the heart and other organs, have you heard this also? I have not heard of a heart infection, but I think we are still seeing data coming out from the autopsies. And so I'll dig into that. I'm going to make a note of that to look into that, because on tomorrow's live, if you tune in, I'll try and answer that. So the heart bacteria. Sorry, I'm at home, so you're going to hear the dogs probably bark because we have a lot of Amazon packages coming. All of my welcome bag stuff is like getting delivered today. I got to take a deep breath. I can't tell you, yesterday was like a day from hell. Canceling or postponing our wedding plans literally gave me high blood pressure. And I see lovely fee 42307. I heard people with high blood pressure could be affected. That is true, because of that whole heart-kidney connection. High blood pressure is often kidney related. The kidney is part of that golden triangle. Okay, so Tender Leather wants a list of the lung boosters again. So lung boosters to boost your immune system, Comfrey. I like Mulin. I like, as long as you don't have an autoimmunity, I like echinacea. I like zinc. And then really powerful, and I'm going to start to canvas my little, you can't see it, but I have a huge box of stuff over here. Lung-wise, okay, so you guys know I'm a lover of traditional medicinals. And when this all wraps on YouTube, I'll put links to all of these. Traditional medicinals is one of my favorite tea brands. They have this, I grabbed a seasonal sampler. They've got the Gypsy Cold Care. They have the Throat Coat, Echinacea Plus, and Breathe Easy. So let me list some of the herbs. They have ginger. Ginger is an excellent herb for promoting and moving excess fluid. So that's great in any type of that bronchial stuff. We get fluid, lymphatic fluid. We get excess interstitial fluid. We get fluid in and around the mucosal membrane. Ginger can help break that up and move that out. So it is a very good motivator of excess fluid. That's wonderful. We also have eucalyptus and peppermint. You can consume these. You can use the oils. You can diffuse them. Hi, Carla. Oh, thanks so much. So this is really, I love this. And I actually have, she's not watching because she's not really connected on these channels, but I have a very, very close cousin. She's like an aunt growing up to me. And I'm going to get really upset because she's up in Minnesota and she's in an assisted living facility. She's fine, but they're in a lockdown status. And there are patients upstairs in a much more advanced state that have some unknown virus. And she doesn't drive. She can't get out. So I bought a lot of stuff to ship to her. So this is one of the things I'm shipping to her. And I'll show you some other stuff. So here's a big one. Okay, saline spray. It sounds crazy, but saline spray is going to be necessary. We want to really impact, I'm sorry, the dogs are inside. We really want to impact our immunity in our sinuses. Saline spray keeps our sinuses moist. The salt in this is also antibacterial. And while it's not necessarily antiviral, it does keep our immune system functioning. And when we have dry mucosal membranes, that's where we're more susceptible. And because this is transmitted through eyes, the nose, and the mouth primarily, that's where we're going to see a lot of this transmission. This is really helpful. I also want to talk about the oral capacity. Oral probiotics are essential. So you guys have watched some of my video content, you might be aware that I have spoken a lot about the oral microbiota. It's very, very key to boost the oral bacteria level. Sorry, Instagram, my phone's getting a little low on energy. So probiotics are going to be key both for your gut, but also for your oral cavity. That will help minimize some of that weakened immune system of our oral cavity. So if you're bordering on like gum disease or gingivitis or bad breath, or just have, dental caries or whatnot, that can be very helpful for help boosting your immune system. The other thing is gargling with salt water. The pink Himalayan salt gargles, always helpful. The saline flush. Shelly Ram said, can the saline spray be dangerous? I heard that it was yesterday. No, there should be no reason that should be dangerous. As long as you are not pushing this way up your nose or causing a nosebleed, salt spray is very, very, is very good. Okay, so I've got MRTI, Maniva. Hey doc, I have COPD. Should no use I don't know what that is, but let's talk a little bit about oregano. I'm seeing comments, oil of oregano, question mark, dandelion tea. Okay, so oil of oregano is a powerhouse when it comes to immune boosting. You can take it orally. You could drop it in like this. This is bone broth. I usually drop it in I do like 2 or 3 drops, and then I just like shoot whatever I'm sipping down the hatch. Unfortunately, last week, Gabriel had a little ear infection in one of his ears. And so I will use it to help open up the synovial joints. So these are joints in the ear. Same thing here, bronchial. So let's talk about oils. Zinc is safe for toddlers. So yes. I'm just going to be kind of answering all the questions as they're coming through, because it's a fire hose and I love it. So one of the things that can be really helpful is like a carrier oil of coconut. You can use almond oil and add a few drops of your oil of oregano, and you could smear it here along the chest. And that can also help open up some of the gunky fluid, joint fluid, because we've got fluid and space in between each of our ribs. We've got those bronchial passages. It can be very helpful. So I've seen a lot of questions about that. Can I give oil of oregano to my 4-year-old daughter? Yes. She won't like it. Oil of oregano is very strong. It's what we call a hot oil. I would mix it in something that, just like a little bit, nothing, like half of a drop, and mix it up in something super overwhelmingly like tasteful, because she's going to hate it. It will just kind of cause this like happening in your mouth. I don't know if that was a great descriptive. Topically, you don't ever want to put it on the skin by itself. Test your child, test like the neck. The neck is a good tester. But like 1 drop is all that I add to a lot of, I use like the kind of natural chest stuff, and I'll just use 1 drop and I just smear it all over. I do that all the time. I put it on us. I'll just do a little bit right here, back here, and that will help open up the ears. And that's the other thing too. This is going to be upper respiratory. It's going to be sinusy. So you might get ear popping as the fluids being released as the synovial joints start opening up. So yes, zinc is okay. Okay, so let me answer some YouTube questions. And you guys are so sweet for my aunt. I call her Aunt Sarah. I love her to death. And it just sucks. We've got folks in nursing homes, we've got parents, we've got family members we can't access. So here's the thing. If you can equip them with stuff, like I'm stocking up stuff for Sarah, do it. These are good acts of love. And so, we have to work together as a community. Honeysuckle, is it supposed to be good for colds or flu? It's a Chinese herb. Yes, it is very good. And I believe honeysuckle is starting to go into bloom right now. We have a neighbor that has that, and it smells divine when I've been walking my dog. Okay, so somebody asked, do the probiotics, like the oral probiotics, do they get neutralized in the mouth and throat? No, they actually don't, because we have different oral bacteria. And so the salivarius that we're working with, that is orally oriented, and it stays there. And it's actually a tab that you dissolve in your mouth. It's like a pepperminty flavor. So we have a lot of people that are asking, should they be wearing masks in public? Can you use comfrey leaves? Yes, you can, Melissa Kay. And okay, so I've got some questions about kids. I'm seeing a lot of mothers on here, and welcome all of you joining. For all of you sticking through, thank you for your time. I'm grateful. The live will be on a replay on Instagram, YouTube. It'll go on my playlist. For all of you joining or a part, please like this and share this. This is very helpful for us, kind of sharing this content. This is free information, and we really are in this together as a nation and as a whole world, really managing the pandemic that it seems like it hits every 100 years. It's just really crazy. Isn't it crazy? So it's just a scary time. Okay. All right. So lots of gratitude. I'm grateful for that. Okay. So we've got some questions about, let's see. I've got some questions on teas. So I'll address that. You guys are great. I'm really appreciative. You guys chill with my dogs. Oh, your dogs are barking at my dogs. That's hilarious. My dogs have been a major stressor. The idiots got into the trash. Mina, the flat coat's a smart little devil. We lock our trash. She got into it Tuesday morning. And then my other dog, there were like 3 little areas of trash mess. They had all kind of gathered their own. And one of them had to go to an emergency vet Wednesday night. And then Thursday night, Friday morning, all the while, all the hell was breaking loose with our wedding. So it's been highly stressful. Okay, so can you use comfrey leaves? Absolutely. You can use, you can do teas, you can do poultices as well. That is something that I also will be shooting video specific to. Sorry, I'm gonna get a little bit more comfortable here on my chair. Okay, so I'm gonna cross my legs. I gotta get comfortable. We're at almost an hour. Okay, so one of the things that we can use, because this is so long respiratory focused, castor oil. Okay, castor oil is not going to be running off the shelves, and you can buy it on Amazon. I'll post some links. One of my favorite brands. You can even find it at TJ Maxx. But again, I don't want you guys shopping. I want you staying hunkered down unless you have to go out, and making good decisions to keep you guys safe and away from people who might be carrying and not tested. But you can utilize castor oil packing of the chest. So sorry, I'm going to be touching like my areas. So castor oil packing, let me bring down YouTube a little bit. So you can castor oil pack, like the bronchioles are right here. You can castor oil pack your chest, and you can castor oil pack your lungs. You can do this on both lungs. This is very impactful. So in the event you've got asthma, maybe you've got some fibrosis of the lungs, maybe you've had radiation, like a lot of our, not a lot, but there were several individuals in attendance or going to be attending our wedding who have had breast cancer. I have one of my just loves of a friend who is going through it now actively, and she just had her last surgery like a week ago. So this is really key for you guys who have asthma, who have maybe COPD. You can use castor oil and pack every day. Now, what is that going to do? It's going to help start to break up some of the scar tissue that might be in amongst your lung tissue. It can help detoxify and move the lymphatics. Your lymphatic system is going to be a major defense mechanism. Our immune system is linked to our lymphatic system. And I saw we've got Rita Rack77. She says she has multiple sclerosis and I am taking DMT that compromises my immune system. Is there something I can do to protect yourself? Yes. Moving your lymphatics is going to be key. Castor oil packing the lung, the upper area. Now, caution, never castor oil pack your thyroid. Okay, so that is an area we want to avoid. That'll over exaggerate it. It can kick you into a thyroid storm or even hyperthyroidism. Don't do that. So I'm just going to encourage you to stay away from that area, but you can castor oil pack the lungs, the bronchioles. That will be very healing. Now, in the event that, I'm just checking my Just checking my Instagram for my time. Okay, so my phone, I've got 16% on my phone. Okay, so let's talk about castor oil packing. You can castor oil pack preventatively. Will this necessarily boost your immune system? Not per se, but it'll help clear your lymphatics. Having a clear, functional lymphatic system is healthy to your immune system. This is a totally new way, kind of a different way of looking at attacking the immune boosting methodology and approach, but I would recommend that. Okay, let's see. I've got somebody says, check out other alternatives to knee surgery. Okay, so knee surgery, pain, CBD is where I go. And I'm actually going to be shooting video this weekend for my CBD vendor. It's not going here on my YouTube channel, but I'm gonna be talking about the connection. There's a lot of really great research about that. If you guys are curious, hit my website where I'm gonna be posting a lot of information because that's key. Okay, Tender Leather said, can you just rub with the castor oil every night if you cannot pack? You can. I will say it's kind of messy. And I do have a castor oil pack video on my YouTube channel. So you can run over there, just go to my channel and you can Google. We're at about 410, 420 videos. So now you can actually search in my library. And it's also, I do a specific castor oil packing tutorial in my healthy booby care course. Yes, if you have your thyroid, it's okay. You just don't want to. So with the thyroid questions about, you don't ever want to do any castor oil over here. So nothing on your neck, but like here down. I castor oil pack my liver. I've castor oil packed my leg, my knee. It's great for reducing swelling. One of the things you're going to notice, and this is the effectiveness, is going to get fluid flushing, and that's a very good pro-lymphatic mover. But we definitely want to really implement those lymphatic elements, getting in the homeopathics, really moving the lymphatics with dry skin brushing, body brushing, doing rebounding, jumping on a trampoline or doing any type of activity where you're getting your lymphatics moving. That's going to be absolutely, absolutely key. Shannon, I'm so thankful for you, Dr. Melissa. My daughter, 21, is type 1 diabetes. How to advise on protocol for her? Okay, so, the big thing is just for her, with diabetes, it's the same protocol as everybody else. In a state where maybe we have somebody who's got the fibrosis of the lungs or a little bit more of an immunocompromised state, it's just a matter of with diabetes, you just want to be staying on top of her sugar levels. And as long as there are no other underlying kind of components, just follow the, kind of normal immune boosting protocol. And again, this is totally free. I built this for everybody. In a day, I think we had 1.8 thousand people download this when it went out last Friday. So there's this checklist. And again, it's got everything, some details. It's got links to resources. These are all on my cart. Oh, for some reason, it looks like I only have 2 more minutes. Oh, I guess you can only go live for an hour on Instagram. So Instagram, if we shut off, I'll come back on. Okay. YouTube still stands strong. If you guys want to switch over and head over to my YouTube channel, awesome. But okay, I'm going to keep answering some questions. Somebody said oregano is such a controversial one. I read about it. Is it only safe to take for a couple of weeks max? You're fine taking it as frequently. I mean, it's one of those things. It's pretty intense. I only do it daily when I feel the need, just to kind of get me over any type of ick that I'm feeling. For me right now, this is probably our most stressful week ever. And so I'm just doing a lot of immune boosting and again, staying on top of my bone broths. I drink about 2 or 3 of these a day now. And they're really, really good. Okay. So most welcome for all the help. Okay. So YouTube, Instagram is going to go away for a minute and then they'll come back live as I get them back up. But I'm going to answer some questions. Heather Anderson, what about folks with low blood pressure? I have chronic Lyme and have low BP, very sensitive to antivirals and antibacterials. Taking colloidal silver, excellent. This is another one we're going to talk about. Very small dose and some elderberry. Is that enough? Okay, so one of the things with low blood pressure, licorice can be very helpful in boosting. A lot of times there's that Lyme infection, underlying infection, underlying immunity imbalance, as well as a decrease in adrenal function. So a lot of times when I've got folks that are dealing with a co-infection, like Lyme, we will see individuals dealing with a low blood pressure, and that's an adrenal state. Okay, so it looks like we're going to get you Instagram back on. Let me share this story. Oh, I didn't save it. Okay, whoopsies. Okay, so let me go live again. Sorry, you guys. Okay, I'm going to pick up Instagram again. Hey, Instagram. Welcome back, everybody. If you're just joining us, we're talking about COVID-19 tips and resources for you. I'm answering live questions and answers from all of you. YouTube has been live with me for an hour. If you missed the first hour, you can check out my stories and grab it there. Welcome back, everybody. Shoot me your questions down below. Okay, so we're talking about low blood pressure and the connection to possible risk factors for COVID-19. I haven't seen specifics about the quantity of folks that have come down with this or are in the 16 to 18% that have the severity of this, if that is a factor. Low blood pressure is an underlying factor. So I'll have to dig into that and see if we have any data, because again, data is really very limited as we're just all learning this together. But I will say low blood pressure is often indicative of the adrenal state. And so adrenal boosters would be increasing your licorice. And that actually is in a lot of stuff. And I'm trying to see if I've got anything around here. But a lot of times licorice will be in, actually it's in this. It's in this super lysine that I had mentioned. That's very helpful. So one of the things that I would say is your best bet would be really focusing on boosting your adrenal state, because that's your fight or flight response. And that's your producing neurotransmitters. It's your the functionality of putting together really that connection between our adrenal state and our neuroendocrine balancing, and that in turn has an immune impact. So I hope, Heather, that was helpful. I know that's like really there's just a lot. There's a lot, and I know each of you is dealing with a different situation. And so one, don't stress. Just equip yourself with, information. Watching my lives are going to be very helpful. And I feel like I need to say what I said to my friend, who's sitting in the public shopping lot or shopping, she was in her car in her parking lot at the local supermarket. And she was like, I'm feeling anxiety. I don't even know what to do. So take a deep breath. It's very easy to be overwhelmed and in panic mode, but just treat it like you would a cold or flu. And that's what I'm recommending. And that's what I did. Like, I actually went on Monday because I started to see some changes in the numbers Monday. And I was like, okay, at that point on Monday, we were going to be leaving. Well, on Monday, I was supposed to be traveling to Vegas Thursday, and I'd be coming back on a red eye tonight. And Brian said, I think this might be a bad idea. I checked to see if the conference was canceled. It wasn't. It's just crazy. I don't even know why they didn't, but they didn't. And that was something we thought, well, this might be a little bit of a risky factor for Brian if I was exposed. Do I necessarily want to be sick for my wedding? That was a big question. I was like, hell no, I don't want to be sick. We planned for this. And so I asked to do a WebEx, and that actually, we're going to be doing webinars later on. So that conference got delayed. Brian opted out of his travel. So we were at home this week, and I started thinking, okay, we're going to be leaving town. This is going to progress and things are going to get worse. I don't know at what rate. And we are all in this, like, we don't know what rate of progression we're going to see. These numbers are going to get bigger. We're going to start to hear cases already. I know several people have been exposed already. We haven't been in contact with them, but I know them. So I thought, okay, we're going to be out of town. We're going to be going to our wedding in Florida. So I need to treat this like if we were going out of town and I'm going to have all three of us, Brian, Gabriel, and I, if we're sick, what do I need? Resources. And so I started to pick up stuff. Like, I literally went to CVS, and it was just one of those things, like me going out of town, and I was like, I'm here. I'm just going to see what we've got. I have one of those like 20% discounts, which, by the way, holy cow, CVS, you can get some great savings there. I rarely shop there. I'll send patients there if they need to grab, some homeopathics or whatnot. But wow, I saved a lot of money. So I got Ricola because, sore throat and whatnot. These are good herbals. I ended up getting stuff that I love. This is a really good booster. It is something that it's always a go-to during cold and flu season. It does minimize some of the symptoms. So this is what we know. And this is where my brain was on Monday. And I wanted to share this with you all, I think Tuesday or Wednesday. Things went a little south with me because I had a little minor dental prep surgery. It wasn't a surgery, but the stress Tuesday, I went over the edge and I actually developed a crazy hematoma. It was insane. I'm okay. It was all wedding stress. A lot of stuff was just kind of stirring and I started to have like this panic. So at any rate, that's like a side note, but one of the things, this is what I was going to say. One of the things that I wanted to do in my intention of going live with all of you midweek was to say, look, here's the deal. It's coming our way. We know we are going to know people. We might be impacted. We might be dealing with it now, or it might be something we're going to be exposed to. Most of us, at 40 to 70% I had projected, and through the Harvard statistician said we're all going to have it, but our symptoms will be mild. They might be cold and flu. Well, the challenge with COVID-19 is we have no vaccine and we have no sort of complementary care when it comes to helping lower the symptoms. And the symptoms are usually where we see the co-infections, where we see people develop pneumonia, where we start to see people get sick because of all of the stuff that, they're starting to get compromised. They've got more mucus, they've got then bacteria. So it's viral first and then becomes you're exposed to bacteria and your immune system just can't ward it off. So I thought I'm just going to start equipping us with stuff that'll minimize our exposure and limit the symptoms. So cold care. And for all of you on YouTube, I'll be posting links when all of this gets wrapped. It's probably going to take a little while to upload because this might be an 1.5 hour, 2 hour long video, depending. I'll go as long as I can. More than likely, Instagram's going to show off because my phone's dying. But hey, everybody, by the way, if you guys are loving this information on YouTube, the live chat, if you want to donate to our channel, awesome. I appreciate that. There's a little like money button, so you can hit that. Okay, so here's the other thing I thought. Okay, it's going to affect our sinuses, our upper sinuses, our upper respiratory. Cold calm is one of my favorite go-to. Sinus calm. That's the way to deal with the symptoms. This is homeopathic. This will be very beneficial for lowering your immunity, or not lowering your immunity, boosting your immunity, lowering the symptoms. So lowering and addressing the symptoms. Going back to that tea that I got, I started to get each of the ones in the sample. So throat calm, we might have a sore throat. That might be some of the stuff. The other thing, I love elderberry. Now there's a caveat with elderberry. A lot of immune compromised folks want to minimize how much elderberry they're consuming. These lozenges, these are my go-to. Like I just grab stuff that I buy normally when I'm traveling. And so that was the other thing. I was going to start to equip my travel bag for my Thursday flight out. I wanted to make sure I was equipped. I had my zinc. I'd be sucking on this in the airport, minimizing my, just exposure that way. So this was really great. I grabbed that. Similarly, because it's allergy season and I'm starting to deal with some of the blooming that's happening outside, just like the cold and flu, they have an allergy, but it's also sinus. And so the sinus component here with it'll address cough, congestion, runny nose. Well, these are symptoms of COVID-19. So it can help minimize that. And there are homeopathics in this. These are chew tabs. They're actually really good. And then I had mentioned how I deliver my oregano oil. So again, I grabbed it at CVS. I actually usually find this at Walmart, this Maddie's, or buy them online. But this is a chest rub that I use particularly with Gabriel. I'll put a few drops of the colloidal or the oregano oil and put it in there. So that's really, really huge. But chest rubs, let's think about it. If we're congested, we want some chest rubs. Poultices. This would be what we'd consider a poultice. Those herbals, as we're breathing, our body heat, maybe you do have a temperature if you are going to be, dealing with this, or even cold and flu. That can then infuse those oils that can help open up the bronchial passageways. That's going to be essential. Hey, everybody, if you're loving this, give me a thumbs up. Let the algorithm sphere know you like this. Here's another thing. I use this all the time, the TheraZinc. So this happens to be an elderberry. It's like a raspberry flavor. I've been carrying this for over 10 years. So I just started to go to my main resources that I would use if we were dealing with cold and flu. Like I told my friend, when you're stocking up for your home, treat it like a hurricane or some sort of natural disaster. This we want to treat like a cold and flu. What would you have in your home for cold and flu season? If you don't have it, now gather that. Order it online. Don't go out to the stores. Everybody's running out to the stores. It's mass mayhem and mass transmission. That's the worst time to be running out. Also, this is off-brand, but this is the kids, because again, I have a child. I need to equip Gabriel. If we're at our, the plan was if we're going to be at our wedding and he's down, we're not going to have time to run out and get stuff. So we were just going to pack like a whole bunch of stuff just to have on hand. Preparation, planning meets the situation. You are equipped and you're not stressed. You're not exposing yourself for others. That's what we've got to think about. Okay, so this is just a homeopathic daytime, nighttime. It's just homeopathics to deal with congestion and colds in kids. I'm going to start Instagram. If you have any questions, comment down below. I'm going to be answering questions. And welcome back, everybody. We're live on YouTube as well. I'm going to answer a whole bunch of YouTube questions because I've seen a lot of comments coming through. And thanks, everybody, for joining me. We're at 300 on YouTube. So we're at about 330 so folks. Okay, COVID-19 says, I have 2 brothers, but they feel no obligation to help with their parents, so that leaves it all on me. I'm sorry. And that definitely is a stressful situation. Just do your best for yourself and your family. And, that's one of the things I say, we're in this together. Taryn GI coupon and CVS has great deals on vitamins. I wouldn't say all their vitamins would be what I would go to, but holy cow, they have good savings. Pork rinds, I love that handle. Also, it's important to drink a lot of fluids because if you are exposed to the virus, drinking a lot of fluids will push the virus down in the stomach. That is very true. I've been reading about that. Okay, so we have Richa Jain. I'm from India. I had cancer and had right breast mastectomy. My lymph nodes were also removed. Now I'm swelling in my arm and you have pain. How can I get slimmer arm and pain and free arm? Okay, so that's a really good question. You would fall into the category of my lymphatic patient, where I would say start dry skin body brushing, hit my YouTube. I have 50 YouTube videos that give you a DIY self-arm lymphatic moving, dry skin brushing DIY tips. I show you how to move the lymphatics. I also recommend some herbs and homeopathy that you might be able to get. So I would say hit up my YouTube channel for more information. So one of the things that I'm seeing some information is, and let's kind of clear this up. Okay, so we've got a hospital worker, Maria Asplund. I work in a hospital and have had the pertinent up-to-date information, and I can tell who can help here. Let's see. She says, COVID-19 laughs at face masks. It's not airborne. And she's going to comment some more. COVID isn't airborne. Most people will get it to give it to themselves, right, by putting it on their own mucous membranes. That's where I'm talking about the eye, the nose, the mouth. That's why they say fingertips are, you want to avoid touching your fingertips. Literally, I was paying, I have one of my credit cards here. I was paying at the little touch station and I literally was like hitting the buttons with my credit card. And then I wiped off my credit card like crazy. So I have the luxury of having a medical supply account. I called them early last week and said, I'm going to need more supplies. I'm not seeing patients, so I don't need it necessarily for patient care, but I want to have that on hand because we were planning on driving. Like we did this whole rearrange of our schedule where we decided we weren't flying down. We thought airports are petri dishes, and they are, and that refiltration of the air. If you look at, as of early in the week, we started looking at, I looked at the whole scope, and it was always points where there were major airports. So guess what? That's how it's traveling. And so, airplanes, we just said, we're going to drive down to Florida for the wedding that we have since postponed. By the way, for all of you new joining, we're not getting married on Friday. We're postponing, I think 13 months out is what we're looking at. But we'll have all the same vendors. We'll have everything's planned out. So almost everything's been paid for too. So it is what it is. But our Maria Asplund is right. She's a hospital worker, completely right. Oh my gosh. Okay, I'm going to read somebody from Instagram. High Fit Healing. My mother has COPD. Is there a way to tell for someone who has cough and breathing issues all the time if it's COVID or just their symptoms acting up? That's extra essential for COPD care here. That's an excellent question, because a lot of the normal conditions that we might have might present symptoms that look like COVID-19. The biggest thing is really assessing the breath. If there's extreme shortness and tightening of breath, that's abnormal or above and beyond the normal condition. And you start doing your treatment plan, like using the nebulizers or whatever breathing treatments, you do the kind of the steroidal treatments, and it doesn't have any impact, and you start to see an elevation in heart rate, you're at 101 fever. The fever is the big key. So fever coupled with maybe more extreme symptoms would be a just reason to call your doctor. What doctors are recommending is call the office first. They may start recommending that you kind of start to self-monitor. They might recommend that you go to, I would not go to urgent care, but I would definitely call the ER. I will tell you, one of my gals, I love her to death, that I work with in Ohio, her daughter she got stuck in Spain. Oh my God, poor thing. So they got her out, crazy ticket to New York, and she's back at home. Two of the girls that she was with on that travel are coming down with symptoms that are very COVID symptom-like. And Cleveland Clinic up in Ohio has developed a drive-through testing. We're going to see more of those popping up. In that type of event, that would be a situation. Find out, stay on top of online. I will recommend for all of you new joining, I have this checklist, and I have resources. I've got direct links. All the underline are links, so you can download. This is a free download. YouTube and the description box has this, so please grab this. These are going to be where you can grab more resources. So like the cdc.gov, the World Health Organization website, there's coronavirus live updates. There's a really good one that's keeping everybody abreast of the data. And the National Institute of Allergy and Infectious Disease, they're kind of running the show at this point in terms of that detail. But stay attuned to your area, because we are going to see, the test kits should be coming out. We'll probably have a delay. I think we are past the point of not wanting to test people. And sadly, that was a reality. If you don't test people, you don't have numbers, and it's not as bad as it is. But that is absolutely negligent when it comes to how a country and how a culture, how a civilization should be addressing this extremely contagious disease. And it is a contagious disease. It's not airborne per se, but there are particles. So let's say somebody sneezes and you're within 6 feet of them. Those particles could get into your mucous membranes. That's a transmission point. I read an article, I want to say Thursday, that this is, again, latest and greatest research. I think it came out the 11th or 12th. One of the things that they're seeing is that there is fecal to oral transmission. I mean, that's like a whole other situation, like using public restrooms. So, that is kind of crazy. And you start to think holy cow, you are safe in your home. You're safe in your environment. You're safe in your, I don't want to say go cocoonish, don't go xenophobia, but definitely be cognizant of your exposure. And again, more information is going to be coming out. Okay, so I'm going to start addressing a lot of comments. Thanks everybody on YouTube. Love it, love it. Thanks for sticking in. Okay, so have Lyme flare now and is on medication and herbs. My poor stomach is getting trashed, worried about my immunity. I know. Hang in there, keep doing all the good things that you're doing. Don't stress, get lots of sleep, stay hydrated, eat your fruits and veggies, get your micronutrients. Those are the things that we can do. Equip your lymphatics, move your lymphatics. That's going to be a good immune booster as well. Okay, so let me go down. We've got somebody in from Russia. Hey, Alan. Okay, I've got lots of questions. Okay. I see lots of good communication. I love that everybody's communicating with everybody. HL Zards, can you nebulize colloidal silver? Yes, you can actually. I know folks that do. You can absolutely do it. Colloidal silver is excellent. I actually wanted to do that with my grandmother when she was in the end stage of her life, when she had her pneumonia. She had that golden triangle I had mentioned a little bit before, congestive heart failure. She was a diabetic. It started to impact her kidney. Like it was awful. And just the throat congestion, the hospital food would come in and there was milk, dairy products. That's so freaking ridiculous. And by the way, to note, food-wise, dairy is mucosal producing. It will enhance the mucus. It'll enhance your congestion. Get rid of dairy if you are at all compromised in that whole airborne, or not airborne, I just saw a comment, that whole congestion, bronchial weakness, lung weakness. Get rid of dairy. And what is the opposite of dairy is ginger. So ginger tea, a lot of these teas that I grabbed and kind of equipped us with, they have ginger. These are very, very good promoters. Okay, so I want to also share with you, sorry, I have this whole, I'll take a picture. If you guys go to Instagram, I'm like grabbing it. I'll take a picture and throw this out on Instagram on my story of like my little kit here. But olive leaf, I grabbed this from Sprouts. I didn't have any on hand. I just wanted to make sure I had them. Olive leaf is a good antiviral. So you can have immune boosting botanicals and good immune boosting homeopathics, but you can have antivirals. So antivirals, olive leaf, colloidal silver, salt gargles are very antibacterial, antiviral. It is very beneficial for that. Let me share with you some of the things okay, this is another one. I again, going to CVS on Monday. Zarbee's is a brand I'm aware of. I don't always use them. They do have a really good throat soothe supplement, but they've got this sinus and respiratory support. Can you guys see that on YouTube? My lights are really bright. And this camera's a little wonky. But this has elderberry, it has citrus bioflavonoids, and it has an African geranium root extract. African geranium root is a good respiratory herbal. So this is a botanical solution. And it's very good for that. So I grabbed these. These are little pills. Again, I'm building the little resource pile for us. It was all about prepping for our wedding. We were going to be away from home. We wanted preparation. The other thing, these are basic things. Zicam. Zicam is something you might want to consider grabbing. They've got those little swabs. Zinc. Zinc's a frontline defense. And I've seen a lot of people talk a lot about zinc and garlic. These are all really positive things. Garlic, raw garlic, cooking it, putting in broth, like all of my bone. Oh, here it is, my bone broth. This has garlic in it. It's really good. I have seen, and by the way, Instagram, welcome everybody. We're live on YouTube. Please give me a thumbs up. This lets everybody know you like this content. Share it. I appreciate that. Instagram, we've got a full hour on my stories that you can grab and watch this live. Sinus Calm, yes, it can be taken on if you have high blood pressure. Okay, Robitussin. I grabbed this for Gabriel because this is, again, actually, this was just to have on hand in the event Brian and I got kind of congestion. This had some good stuff. And I was not upset about some of the ingredients. Some of these like over-the-counter ingredients are not always in alignment with what I want to see. But at this point, I was like, we're preparing for a wedding. We want to have all the resources on hand. So that's one of the things I grabbed. I do want to share with you some things that I grabbed for Gabriel. So for all of your parents, you want to get your kids ready too, because they could be the transmission point for you or your parents or your great aunts or any of their, any risky family members. Mucinex, this is these little mini melts. I actually like these. We've had to use this with Gabriel more recently, and it's got the cough suppressant expectorant, and it's a really easy delivery method. He's at this point where he's not totally into taking all of mommy's crazy stuff. He's very good. He asks for his supplements all the time. Mucinex is great for kids. This was on sale. I actually grabbed this from Target. The Bliss, this is a kid's cough syrup. actually love this Mommy's Bliss brand. It's really good for some items. Other thing, saw this at our Sprouts. This is Echinacea Zinc lozenges. This actually has a whole bunch. It has rose hips, which is boosting your vitamin C levels. It has echinacea. It has, let's see, lemongrass, perilla leaf. It has a lot, orange peel, lemon peel. Sarah, hey Sarah, what herbs and supplements can we use to support our immune system if we already have an autoimmune issue so as not to cause complications? That's an excellent question. One of the things that I am saying, and I'm actually, I will be producing a specific video for autoimmunity and COVID like preparation, you know, in the event you have it or are trying to, obviously we're all trying to minimize this in our body. In our lives. One of the things that I'm very cognizant of, echinacea and elderberry can be immune boosting in a negative way to autoimmunity. So autoimmune regulators are going to be a big key. I actually love olive leaf for that. I love astragalus. I have that somewhere. Neem. Okay, nobody really thinks about neem. Neem, I guarantee this will still be on the shelves, friends, and in online. So I say shelves because it's just common, but order online. Don't go to the stores. Please save yourselves from that craziness and exposure, because right now we have a lot of people who probably have this or are transmitting it and don't know it and aren't being tested. I want to share with you this really fun one. It's called Kick Ass Immune. It's a spray, and it has baptisia root. It has elderflower, yerba santa. Yerba santa is another good, it won't impact the autoimmunity. Yarrow, cinnamon, it does have echinacea, golden seal. Golden seal is really, that's another good one for the mucous membrane. So golden seal, there are drops like neti pot drops that have golden seal, yellow dock, burdock. Those are 3 really good botanicals that are really good. Shelly Rams, you're so lucky with your choice of natural products. UK is really hard to get natural products to find, and it's so expensive. I totally understand that because I actually work with a lot of folks in the UK. And sometimes I've even shipped stuff to folks to get it through. Customs is being a real pain in the butt lately. Okay, so long leg Lithuanian, going to the gym and swimming pool for exercise, ? Okay, so I have been reading supposedly, and I've got it, this is not confirmed. Supposedly the pool, the chlorine is enough to attack the shell of the virus. But gym, like while we're chatting, I got some message from my gym. I'm hoping they're saying, we're just gonna kind of lay low. I am not going to the gym. I was like all gung-ho working out 3 to 4 times a week at this Spenga gym locally. I'm just not gonna put myself at risk or bring something back to Brian, who, you know, with his ITP, his autoimmunity, that would be like, he'd need infusions of platelets and IVIG, I mean, immunoglobulin. I mean, that like, we're not going that risk factor. So we're clamping down. So I would say if you can minimize your exposure, I mean, think about like gyms, okay? People are sweating. I was even thinking about like the spin gym. I love it. They, you know, you do 20 minutes of spin, then we do strength, then we do yoga. Well, in the facility, I can stretch out my arms and literally I can touch the person next to me, like almost on their bike, like in that kind of middle section. That's not 6 feet away. So I have friends and physicians that are approaching their patients 6 feet away with masks on. We should be cognizant of that. Gyms, you know, I also don't want to be in a situation where I'm trusting other people to make really wise health decisions, if that makes sense. And that sounds really kind of mean. It's not rude and I'm not trying to be offensive, but the reality is that we can't trust that other people are washing their hands thoroughly. We can't trust that people are coughing or sneezing into the crook of their arm. And we can't trust that people are self-quarantining. I was made aware of a possible guest to our wedding who might have been exposed. And that could be all of us at this point. So, you know, we have to rely on ourselves first and foremost, and sometimes limiting that, like I'm going to be doing more gym related exercises at home. IT Hag P, can you do a video on golden seal? Absolutely. Zinc and vitamin C are going to be good for just immune boosting. Mushrooms, absolutely. They are also an immune modulator, as 1A has commented here on YouTube. The other thing too, you can gargle with apple cider vinegar. That's a really good throat gargle. That is a very good killer of germs and any viral, bacterial. So that's not a bad idea. Now, I also want to, I'm just kind of grabbing some of my stuff here. Yeah, like I'll just show you. I grabbed Mucinex. Now, would I normally go with Mucinex? Probably not, but we just don't know what the impact might be if we were to come down with this. I actually grabbed this for Brian because I thought he would want this. But you know, just having these things, just think of your medicine cabinet. If you have this stuff already, you've got equipment. But in the event you are sick, you don't want to have to be, you know, waiting to get an order online, and you certainly don't want to be going out in public by any means. Okay, so the other thing, Margaret Green, Melissa, any thoughts on lung support for asthma? Yes, I've actually commented a lot about that. I'll just do a quick recap. Mullein is really good. Comfrey root, yellow dock, burdock root are great for lungs. Poultices, herbals, using oregano oil in like a poultice, like a chest rub would be a good idea. Instagram, I might be losing you pretty soon. I'm at 1%. So if we go down, join me over on my YouTube channel. For all you guys on the replay, we might still be live. Colloidal silver, I actually love to use that as well. And there are several brands. I actually like the one with the wings. I can't remember the name of it. But the other thing I want to talk to you about. Okay, so I started to notice this a week and a half ago. Okay, I remember going to the Walgreens. I usually, if I'm out of Epsom salts, I'll go to Walgreens. Again, that's why CVS, I was like, wow, big savings. I usually go and get Epsom salts, and it's always by like these cleaner stuff, like the peroxide, not cleaners, but like antiseptics. Well, they started to go out of gloves. They were out of gloves. They're out of masks. The masks, they are definitely not going to protect you by any means, but they were okay on hydrogen peroxide. This is a very good resource. And in fact, if you have hydrogen peroxide and you have alcohol, like 65, 70%, and bleach, you can do a combo, and that becomes an antiviral, mega, like hospital grade, kind of wipe down spray that you can, house in a spray bottle, like my glass spray bottle that I use. So there are things that you might have access to that if you're out, you find that stores are out, you can't get access. Let me know. Do you guys want me to give you a video on like homemade stuff, like to equip you with resources? Because I totally can. And I'm happy to do that. I do want to share with you to that point. And by the way, thanks to everybody joining me. And Shay Yi. So there's a question about cleaning toothbrushes. I use hydrogen peroxide on my toothbrush. So after I brush my teeth, I just spew it on. And even before I brush my teeth, I will do that. I have friends that will put it and, have a little glass, and they'll have a little cup of hydrogen peroxide, and they just keep their toothbrush in it. That is very good. That's good anyway. Like that's a good way to minimize the germs in your mouth. So you minimize the, bacteria that might be lingering in plaque or would prevent or create a dental carie. But let me know if you guys want me to do this, like homemade kind of natural cleaning, because that was the thing. Like I ended up grabbing this, the Lysol, and the EPA put out a list of products that they recommend that are safe. Safe in terms of like killing the human coronavirus. This is a novel form, but what they're finding is that a lot of the Lysol products have the agents you need. So I grabbed this because it was clear, and it was one of those things like I do have my Force of Nature packets, but I actually have more on order. We've had Gabriel a little ear issue, and then I've kind of been sanitizing a lot more, and I actually carry my spray bottle in the car. So this is something to think about, not only just equipping your home, but are you equipped at your office? Like if you do have to go into your office, or if you are client facing or facing the public, are you equipped? Don't rely on your company to give you all the materials. That is key. I did not assume that with our wedding, but I was really like on top of it with our vendors. And as it turned out, the venue told me on Friday morning, and that was a big thing too, that they did not, the supplies, their ordinary supplies of hand sanitizers, when I was like, can we have hand sanitizing stations at like all these points? They said their supplier diverted their supplies. That's crazy, because I would think they would be prepared, but they're not. And so that could put people at risk. And so we need to think about our cars. I have all of the things that I would use in my home or in a work setting in my car as well, because I'm out and about, like I'm getting gas. Well, guess what? I'm wiping down the little gas thing. I'm wiping down the gas handle. When I get gas, then I wipe down my hands. I do like all the stuff that you should be thinking about that a lot of times we're just not even cognizant of. That's where things are moving. Okay, so Melody Chase, Supplements Revealed. Thank you for telling us about it. Oh, yay. Isn't it great? Supplements Revealed was so fantastic. Okay. Oils. Okay, so I want to share with you some oils, and I actually think I have a, sorry, I'm going to get into, hold on. Let me see. I got, there's, oh, they may be upstairs. No, this, okay. So there was this one brand that I actually found at CVS. I'm trying to see. It's called Guru Nanda. Okay, this is their Breathe Easy. Again, this is one of those things, diffusing oils is not a bad idea. There are a lot of diffusers. I've shown on video before, there's USB diffusers, you've got the bubbly water diffusers. And this particular brand has a plug-in. And so the plug-in, you can actually screw the bottle in and it just disperses at a certain kind of pace these oils. So this Breathe Easy is eucalyptus, peppermint, basil, tea tree, and rosemary. These are really good for opening those passageways. So for all of you who might have had questions about lung, risk factors, essential oils should always be in diffusing. You should be in diffusing mode. Sorry, my throat's getting dry. Okay, so the other thing that I'm a huge fan, and this is just one of the brands that I found. I think this I found at Walgreens. Thrive. This happens to have clove. Clove is an excellent defense. So if you guys are familiar with thieves oil, clove is one of the main kind of main components in it. But clove, lemon, rosemary, and eucalyptus, those are very beneficial. Cinnamon's another one. I love cinnamon. I love tea tree oil. So you can have antiseptic, antiviral diffusing through your house. Okay, so I have On Guard going in the house right now. Thanks, The Busy Little House. Hit the like all. Yes, please do. If you like this, you're getting any good takeaways, give me a thumbs up. Share this video, please. It's so helpful. If you guys feel inspired, the super chat is on. You can make a super chat donation. If you have any specific questions, we're answer super chats as well. I love my Herb Farm. Herb Farm is one of my favorite go-to herbals. I've been using them for 15 years, and they have additional herbs like wild indigo, yarrow, ginger, horseradish root. So this is another good kind of immune booster. There's a lot of different immune boosters out there. So we can have immune modulation plus immune boosting, and then we can have immune modulators all on their own for the autoimmune folks. What can I use in my shower to fight germs while showering? That's an excellent question. So it's not uncommon for me to drop some of the essential oils like this in my shower. Now, obviously you want to make sure your shower's clean, that you don't have any mold that's kind of getting, kicked up, but oils and, the diffusing, you get more water, air, oxygen molecules. So you get more absorption. I love that as a delivery method. And Nancy, hand sanitizer with alcohol and aloe vera gel. Yep. Actually, Listerine, that was a good comment. I think I put them upstairs, but I did end up getting, there's a new natural oriented Listerine that has like menthol and thyme. Those are very good. And so, that could be another defense. Again, I always do salt water, Himalayan salt, a gargle. You can gargle with colloidal silver. You can saline flush with colloidal silver, drops of that in it. But that can be very, very beneficial. And then what else? the cold calm is the other kind of alternative to the sinus calm. But so C. Luna, fighting germs, there's a lot of different germs. And in fact, you know, what I always recommend is having a multitude of blends. So like, you know, this blend is going to open up the sinus passages, where this one with the clove and the tea tree, oh no, this has clove, lemon, eucalyptus, and rosemary. Some of that will fight germs. Tea tree oil, melaleuca will definitely fight germs. I love that. So A1, I've been told echinacea is fine for kids, but I don't believe you should give it to them for long periods of time. That is correct. Usually what we say is like 2 weeks on, 2 weeks off. And, you know, one of the things right now is that we're just kind of equipping our bodies with immune boosting and immune regulation for the autoimmune components. That's where homeopathics come into play. That's why I love the boron. That's why I love the Nature's Way, like the Umka. You can achieve the same results without necessarily relying on a botanical that we might have to kind of come off on. Melissa K, family birthday party today of 25 people. Should I go? No, I would cancel. So, and I hate saying that. I literally like all activities where they're gatherings of people from family events. I mean, I think the big thing that happened Thursday and then Friday that really started freaking everybody out and caused this, you know, state of emergency that was declared here in the US for all of you international viewers. I think the big thing was we started to see all these sports cancellations. Disney said they're going to close on Sunday. And I was on the phone with a friend of mine. She's like, you know, when Disney's closing, it gets my attention. And that definitely is something that I think we are going to see more. And I, you know, my thoughts personally, like up in Seattle, I feel like, and I think they are limiting groups of 250. To be honest with you, I'd be limiting groups of any more than 10 or 15. And in fact, I, again, weigh for staying away from groups. I just think it's too risky. We are not testing. People are not getting tested. And until we get some handle on testing, we have no clue who may very well have been exposed, may be asymptomatic, and tomorrow they'll spike a fever. And now you've shaken hands with them, you've hugged them. And that honestly, so Melissa, that was like another thing that was starting to weigh on me on yesterday as we were looking at things going sideways with our wedding for next Friday was, do you necessarily say, hey guys, we have this wedding and we're really excited. We've got a welcome party. We have our wedding the next day and then we have a farewell brunch and we're not hugging. Let's do an elbow bump. You know, that was to me, that was just not in the cards for the special time. And the other thing too is one of our vendors was a cruise vendor, and we had the welcome party. It was going to be 40 or so people on an upper deck for like a sunset sail. And I asked, like, what are your contingency plans? What do you do if the state of Florida comes out tomorrow or Monday or Wednesday, because our cruise was going to be Thursday night? What do you do if they limit a quantity of people in a group setting? And she was like, well, we'll just take your group and then add whatever max. They wanted to go to the max level. I get it from an economic perspective. I get it from a business owner perspective. And I get it from a revenue perspective. But I don't get it when it comes to keeping the public safe. And I don't get it we know collective groups are easy transmission. So I'm just saying that just to be out there. Don't take offense anybody if you're like, I still want to do group events. Then equip yourself, be aware, be cognizant, you know, kind of stay back, don't hug, you know, really, really limit your exposure. And if there are family that are 60 years or older, they're immunocompromised, or they fit that risk category, high blood pressure, they have diabetes, maybe they've got some COPD, asthma, they should not attend. And there should be no family guilt. At this point, you're going to be guilty. And I'm not saying you, Melissa, or any of you guys, but like, you're going to feel guilty if, like, I'll talk about myself. I would feel guilty and completely just negligent if we hosted our wedding and somebody was a carrier, or like our hair and makeup girl ended up coming down with it, which, by the way, apparently she's in quarantine right now. She doesn't know what she has and is presenting with symptoms. She was scheduled for our wedding Thursday and Friday, for my makeup Thursday, and then all of our hair and makeup. That, to me, that's on us. Like, I don't want that responsibility, and I'm not going to be selfish in saying you have to come to my event because we planned it. Like, we can make concessions, and no amount of money is worth public safety and the safety of our loved ones. Can I get a thumbs up or heart on anybody who agrees with me on that? Because it just, like, literally, I started thinking, we started looking at our guest list, and I have a good friend who's dealing with cancer, and she just had a surgery like a week ago. And we had, just a lot of folks that I did not want to put in a situation where they were compromised. And that is the reality we're in. And it's something that, if we are planners of events, we need to pull out. We need to do what we can. We're in a situation where everybody's dealing with this, and it's better to err on the side of being safe than being risky. And I am still shocked that the one vendor continued on with their conference. I will put money on it. I hate saying this, but I'm going to put money on it. There will be attendees that probably will have symptoms because, they've been flying there. They've all been engaging. We cannot be negligent. This is not the time to be selfish. We need to be focused on each other. We need to be focused on minimizing our self-exposure. We need to be minimizing our exposure in group settings. You're right. So LRO, bookkeeper, now is the time to have that kind of conscious. We have to. And life is way too precious. And the reality is there are 30-year-olds that are in ICUs. And so just because we say, 60 and older, those are risk categories, it could happen to any of us. And that is, if I can do anything here in this format of video content and information to you, if any of you choose a different course and it's a wiser, healthier choice, then you're better off. And our community is better off with you being safe. And we can lower that, I want to say epidemic, pandemic. Pandemic. That is an insane word. This is a global crisis. So can I get a hallelujah, people? Okay, so I'll get off my soapbox a little bit, but the good news is I'm planning for all of you joining and staying on here, and I'll probably wrap this at 2 hours because I definitely feel like my throat's getting really hoarse. One of the things that I'm committing to doing, and I will have some help because Gabriel's out of school indefinitely, as a lot of kids are. Georgia hasn't declared it. I think they're out for 2 weeks, but we go to a private school, so they had already sent home packets. We were on spring break last week, which made it a little crazy. But one of the things that I am very aware of and will have help, I want to go live. I'm going to try and go live every day at 9 a.m. So it's almost like a natural health news resource where I just give you updates, we answer questions, and we're all in it together. And if a lot of us are at home, we're working from home, I'm hoping this is a format for you guys to connect socially, because we will feel isolated. And I was watching one news channel. It was like, you can still go outside and go for a walk. We are going to be walking our dogs. We're going to be outside more. I'm going to be planting. I got peony bulbs. I'm going to be planting those later. So we can still be outside. We don't have to be holed up in bed. We don't have to be watching TV and in sluggish kind of format, but we can be outside and active. We just want to limit our exposure to our community. Stores, you want to limit that. You want to limit your exposure to areas where there's a mass population that are coming through and going through. So limit library exposure. Events, a lot of events have canceled. Movie theaters are going to see changes. Restaurants. Now, I've also seen recommendations as well. If you want to support your local restaurateur or your small business owner, that, we might not be shopping with them. And a lot of them might not be online, even like the delivery thing. Like we did do a order out from one of our restaurants, because I just literally felt like a bus had run over me, like back and forth about 10 times yesterday with this whole wedding thing. And I'm just, oh God, it's so crazy. So, it's all good, but it was really stressful. And I just said, I don't want to cook. And so we have our favorite little Italian restaurant. Like Brian ran in, he grabbed one of the dogs that was at daycare. And I'm like, that's going to be the last time we do that. Like I love our Lucias. They're right on the corner. but we're not going to frequent them because there are going to be other people who might not be smart. They might not be staying minimally exposed. And we're just going to minimize that. And you know what? That stuff came, and I made sure I wiped down everything. But it's going to be key. And I see Dale Gilchrist. Yes, get sun. Go outside. Walking is great. Lois, a walk in nature lowers stress and boosts immunity. So read the comments here because everybody has the right gist to it. It's not just staying in your house. And I think that's also a mindset shift. It's being minimally exposed to the public. And we can still be in the public setting. We can still be outside, and I think also it's our time to get back in touch with nature. It's springtime. So if you're in an area where like I'm going to transfer some of my bulbs and some of my plants, and I'm just going to cultivate my garden, and I'm going to work on content, and the wedding's all planned out now. Basically, every vendor has been notified, and we're all good. We're just waiting for some contractual addendums. And then I'm going to save the dates and all that good stuff. But, at the end of the day, and we're seeing some folks, 90% of shops closed. Boa, tell us where you're at. Because I will tell you guys, earlier in the week, I have some part-time assistants that are international. And one, her name's Ella, love her to death. She does a lot of my Instagram postings for me. She is in the Philippines, and she was like, the quarantine's coming, it's chaos, the world's falling apart over here, and was really in panic mode. And, as her employer, the first priority is our health and wellness. And so I was like, do what you have to do. She was like, I was at a store for 3 hours and they're going to quarantine everybody. And that is something like we're seeing this wave. We kind of have to start to anticipate that might be coming. And if it's not going to be mandated, we should look at some self-imposed aspects to that, which leads me to tell you that I'm going to be shooting video over there in my little dining room. I'm going to share and it's not going to be live, but I'm going to wrap it up in a regular video. But I'm going to shoot I did an Aldi haul, which Aldi is great. Now they've got the delivery tools, so you can do the Instacart and still get a lot of the stuff. But I did an Aldi haul, and I ran by Trader Joe's. This was all Thursday. Again, it was one of those things, I was kind of seeing what was happening, starting to sense that we would be gone to our wedding when potentially things would be chaotic here and people would be panicking. And so I was like, okay, I just want to get prepared so that when we come back, we are not void of food or access to stuff. And the other thing too is many of you, I just feel like I've been in this like wedding zone and then traveling. I've been teaching a lot. I traveled twice in February, twice or 3 times. I don't know. It's been really chaotic. And one of the things that happened in my last travel, the second week of February, Wednesday, I flew to Melbourne to teach the following morning. I got a call. It's just after I landed. Brian's panicking because our kitchen sink apparently had a leak, and a massive leak, and it flooded the whole entire cabinet. Flooring's ruined, cabinets are ruined. So literally this happened. Now we're going on, it's almost 3 weeks. We had a demo crew come out. We had it dried. Mold was removed. Luckily, it may have been like a short-term thing. We're going to have to get our floors replaced and our kitchen redone. And I'm saying that it's just annoying because the timing of it was really bad. It actually is working out quite amazingly because I hated our kitchen and want to film for you guys in a kitchen that's bright. And ours is like black and it's just really dim. So all of that was happening. And because of the kitchen demo and knowing we would be probably scaling up the plan was possibly this week while we were gone coming up that we'd start the floor install. So we started eating everything in our kitchen. I literally started exhausting our freezer. I was like, they were like, we're not moving your pantry stuff. And we'll put your refrigerator outside, in your garage. But I was like, oh my gosh. So I started thinking holy cow, I've been kind of, working my stockpile of stuff. And now I'm going to need to get more stuff. And so we're tabling that whole renovation. And now we're not even going out. We need to pick samples and figure out what we're going to put in. But yeah, so it's crazy. So I want to address some of your notes. I'm seeing a whole bunch of things. Jen G, I'm grateful for your live messages and wealth of info to educate your viewers. So thank you so much. Somebody, Tuscany, East says in Tuscany, you're not supposed to go outside. Okay, so when you're not able to go outside, YouTube's great. You can put on some nature videos and do some, breathing exercises and kind of visualization. Meditation is very powerful for transporting us to other places. So Boa says, guys, no panic at all. The data taken in Italy is biased to high deaths, but news and health institutions say the opposite is incomplete data. There's definitely a lack of information, and we're all working off of that. I mean, healthcare providers, we're trying to stay up on information. Nancy, I'm a caregiver and work in assisted living. They're taking temps before we go in. Good. I'm glad that they were screening. I read something that there were folks that came in through customs, U.S. Customs. They were not asked where they had been. They actually had apparently been to South Korea. Their temps were not taken. So, and that's really scary. So, but I'm glad to hear that. House Junkie 777. When I see beside the panic, Americans getting ready to hunker down, with freedom comes responsibility. That's what Americans are doing. Mitigating risk and protecting each other. Absolutely. And that is really, at the end of the day, we have to be smart. And we also have to think outside ourselves. It's not just us. Philadelphia, PA, scared to death. Marianne, don't be scared. Take a deep breath. It will be okay. What we have control over, and this is what I was telling myself with really everything that's happened in the last month, the kitchen, the wedding, chaos, everything. We have control first and foremost over our thoughts. So we can get ourselves calmed down. We can get ourselves into a mental state. We can have control over that. And we're empowered. And then we can make educated choices. We can make decisions that will equip us and equip you with tools and resources. So if anything, first, start to assess your exposure. Start to limit that exposure that we have control over. Work, is a whole big question mark. And like Brian's huge company, it's like Fortune 50, I think. They haven't released anything about people working from home. Here's the deal. Don't rely on your company to do that. If you need to do that, there is nothing, and I don't see any legal standing for a company that if you are not facing people or in like a healthcare setting, why you can't work from home. We're in a national emergency. This out of anything supersedes the normal kind of MO. And because of that, choose wisely. If you can work from home, you stay at home, go out and walk around your neighborhood, but limit your exposure to people. You have some control in that. And then I would say just take an analysis, do an inventory of what you have access at home. What supplies do you have? What might you need? What would make you feel more comfortable and more in control in that situation? And so don't be scared to death, because those words are very powerful. We just need to say we're empowered. Jane E, can our animals be exposed to the virus? That's an excellent question. I was actually reading research last night. So again, work is my escape, and I love what I do, and I love reading research and data, and there's a lot coming out. One of the things that they said that there is potentially a possibility, but it has not been absolutely clinically proven. The question was, have we acquired this virus as humans from animals? And so is there then that ability to transfer back? But the good thing is, at least like with our dogs, as I'm seeing, because the idiots ate trash Tuesday morning and one had an emergency vet visit Thursday night. And yesterday I was there getting x-rays with her. They have very strong constitutions, very strong stomachs, or high acid level. So just, monitor your animals. But as far as I know, there has been some research that was talking about potentially with dogs, but it was not conclusive. So I would say we don't know specifically that information. Julianne G, our hospital just now broke out the outdoor isolation mask quantity tents. Julianne, where are you located? Let us know. That's interesting. So one of the things that I think we're going to start to see is that, like in Seattle, where it was, ground zero a week ago, and that's a moving target at this point. But what we're seeing is the modeling, like in China, how they drove that big curve of infection down fast. They started containing, they started quarantining, they limited exposure. And then what they did is they put people in quarantine to mitigate exposure. And they built a hospital in 10 days where they could put people. And so isolation, the severe cases, that's going to require intubation. That will require breathing assistance. And so, and what that means, let's get real. That's going to be people who are going to be heavily medicated, and they're going to be in what we would consider a coma-like state, because their body will no longer have the ability to breathe on their own, and they'll get that on a 2-week, in a 2-week time frame. I think what we're going to see really happen probably in the next 4 days, and I'll report on this as we go because we're in it together, friends. We're probably going to see drive-through testing centers where you can grab, you literally be tested right there. I think what I read the other day is that from the point of testing, like the big difference in China, like they were doing the CT scans and all the screening very quickly, and you would know, you'd be quarantined, and then do you have it or not? And then there'd be a bifurcation. You can go home, still quarantine and, be safe, not quarantine per se, but like really limit your exposure because you didn't have it now, but you might run into somebody who might. But if you did have it, then you'd be in a full quarantine and on lockdown. And that sounds crazy, but like one person, the touch points of one person could be 20 to 100 people in a day. And then that just expands out. And so, it's not just us getting gas, it's us getting gas, and like how many people get gas at that one station, and like they touch the little keypad and then they go home, or they go to Trader Joe's and they go to CVS, and like how many people? It's hundreds and hundreds of people. And that is how a pandemic spreads. So I'm curious about that, where let's see where the hospital stuff is happening. Okay, see Luna, Melissa, can you block him? I don't know who he is. Sorry, I'm trying to kind of manage all of it. Okay. Okay, let me see. Oh, who's T-Turtle? Here, let me just go ahead and remove. Let me just block. I'm going to block. Hide user. Okay, I'm going to see. I don't know who that is. That's very weird. Hide user. Okay, I'm hiding the user. Sorry, guys, on all these messages. It's kind of weird. Okay, so, all right, Lisette Langzaro. I hope I said that right. I'm not a panic type person. Doesn't seem people in Central Florida are panicking. No toilet paper, but I have baby wipes. I went with a friend to yard sales today. Yeah, so I would say you're right about that. Our wedding is in Sarasota. I grew up over in Tampa Bay. And I've been, in the last 2 weeks, I've been very on top with my vendors, as you can imagine. I actually had on Monday, venue list to me what they were using for cleaning, who their cleaning resource was, and I wanted to know like their procedures. Sorry, you have to be careful. And they didn't take offense to that, but I know I wasn't the first person. I know I probably wasn't the first person, but there weren't a whole lot of us because it took a while to respond. But yeah, it does seem like, even I noticed my wedding planning crew not having the same type of, I wouldn't say panic, but I think Florida's been hit differently. And that's what we're going to see. We're going to see different areas in population. So you guys might be watching. Here's like, everything's good. We have, maybe 2 or 3 deaths and it's contained, right? It's not contained. Don't believe that. There's no lid you can put on this. It's not contained until we get 0. And we're not even at 0. We're in this mass expansion mode. And we know that because of the analytics. The epidemiology of this works. We keep going up. And then hopefully we go down, and hopefully that up never exceeds the hospital capacity, healthcare capacity to address this. But at any rate, I did see that. I felt like Sarasota, they were less than invigorated. So I'll say that, less than invigorated about being really proactive. That will change, like they're on their 3rd death. And from a Friday to a Monday, things can accelerate very quickly. And what that means is that, like, for instance, the hotel, I had a response from the hotel that was quite alarming. When we have hotel blocks at this one venue, and I'm hosting a farewell brunch the next day. And the response was not at all empathetic, like, oh my gosh, I'm sorry, this must be really terrible. Because I listed out, like, quantity of guests with autoimmunity, groom has this issue, groom's parents are not coming to the wedding. Like, this is all going south. And the response was literally, this is craziness. This panic is just media hype. I don't believe it's going to be any more than a mild flu. Okay, that is negligent. And that, to me, I find offensive. And, people in this type of position where we're in like hotels, the reality is what's happening out west is that, like California, the governor has declared that if they need to, they will take over hotels, and those will become potentially isolation wards. They could be extra beds for hospital setting. That is a potential reality. And, that West Coast was the first to kind of have that hit. That might trickle down to other areas. Atlanta has definitely had some stuff. We had a teacher on Tuesday test positive in one of the schools. She goes between multiple schools. They closed down all of the county schools. Fulton County public schools completely closed 2 days. So Tuesday and Wednesday, Thursday, they went back to school. Yeah, and then Friday, it was called off. The governor got on air, I think at 2 or 3, said he's encouraging but not mandating educators to be wise, which means AKA close your doors. So I'm not going to put out a mandate, but that's what happened here on Thursday and Friday, and it's going to continue to happen. Okay, see, Luna, would it be good to just use rubbing alcohol in a spray bottle for surfaces in my house? So yes, you could. That's where if you guys are interested, you could do the combo of the bleach and the hydrogen peroxide. But yes, rubbing alcohol, definitely like 70, I think 91%. I don't have any in this kit. I have stuff from upstairs in my like kind of pile of stuff that I have. Melody Chase, the positive note is this is forcing us to unite with our hearts. I totally agree. Oh gosh, Hans Wurst. Yes, here in Italy, I saw dead people in the streets. I'm so sorry that you had to witness that. That could definitely be very traumatizing and very scary. And that is something. Trinidad, we've got school closing. Canada, more schools are closing, universities. Yeah, we're seeing a lot of universities going, even school districts going to telemed. LA district will be closed for 2 weeks. The challenge with the school closings is that a lot of kids rely on, the only good source of food and nutrition is at the school, which is heartbreaking. And so hopefully those kids won't suffer needlessly, but it is safe because we're going to see school closings because kids categorically and we don't know why. This, again, there's more research kind of honing in on it, but like children are not, their immune system in the lung tissue does not have the same compromised impact that folks that are compromised or older. We don't know why yet, which is kind of interesting. Okay, so somebody's got a Q-tip, the ear blockage. Oh gosh. Okay. So if you have blood in your ear, be very careful. Don't put foreign objects in your ear, folks. I'd wait it out to see. You might have ruptured your eardrum, so that you want to be very cognizant of. Don't put any oils in it. Italy, the supermarkets have closed. I know that I think they're at least doing for a few hours. Okay, so dosing with iodine, Tamara Musqueda. Iodine, yes, I do agree. Iodine is helpful. Again, that's that whole thyroid support. Now, you don't want to use iodine specifically if you've got Hashimoto's by itself. You'd want to definitely pair it up with a multi-mineral. And in the case of iodine, I always go food first. Kelp, dulse, sea vegetables are going to be a good source of iodine for your thyroid. Yeah, so let me tell you guys about the toilet paper thing. So one of the things that it's a psychological thing when you see toilet paper is gone, like, why toilet paper? This is not like, there will be some digestive grievances. Diarrhea is part of the symptoms, but it is not the core thing. It's not the factor that causes secondary infection. This is all bronchial lung related. But what I've been told by one of the supermarkets is that one of the main factories where all the toilet paper is being made, they're actually turning their production, they're producing masks. So that could very well be part of it. It could be distribution. I will say that is not 100% confirmed. I've just heard it from, the Publix. Yeah, so things definitely are moving. Peroxide ratio, I have to look that up specifically. I know if I were to do a cup, I can't remember what the percentage is, but I promise I will look that up. Okay, so we're on 2 hours. Any other questions, shoot them off now because I'm going to go. I'm going to eat lunch and check on my little man. I'm hoping he's been fed. Sometimes, when mom's away, things don't always go as scheduled. I did see, I'm going to be posting, we're going to be posting on my Instagram. So if you guys aren't, I'm going to put my Instagram handle on. So I'm going to type it up and I hope you guys will all follow me on Instagram because that definitely will be a good source of additional info. We'll be posting more on Instagram stories. Let me type that in. So what I was going to say with that is I'm going to share, let's see, www.instagram.com natural health resources. I think that's it. I'm sharing my, I think it should go to my Instagram. I'm just going to share that here in the comments. So grab that if you want to follow me on Instagram. So to that point, I saw some fun COVID-19 like schedules, like parent schedules to follow at home. Our babysitter's mom posted it on Facebook, and it's hilarious because our babysitter's 16, and then she has a sibling who's 12 and a sibling who's 8. And it was like kids wake up, they take a little like outdoor break, and then they come in and they do academics, and then they do creative work, and then they take a nap, and then lunch, and like that is, it sounds cheeky, but I'm not a teacher. I am not regulated in that type of way with my child's plan and schedule, but he will be home for a while, and we're going to need to give our children some sense of routine, and they're going to be stressed. And so that might be, if you want me to do a topic on that as a parent, how am I going to equip Gabriel with some good, healthy adjustments to the schedule change? He's not going to see his friends. He's not going to be going to school. Social interactions are going to be highly limited. One of the things that I really want to be cognizant of is also that aspect. We, as parents, are going to take a big hit in terms of juggling a lot because our kids are going to be at home, and that might change our routine. So maybe we don't even have COVID-19 exposure and we get through this fine, which, anywhere from 30 to 60% of us will be fine and not exposed potentially. The impact will be economic. It's going to hit us where we are working differently. So, that is going to be, that's going to be something for us to think about. So let me know, does this resonate with any of you? How many of you are parents and now trying to figure out, okay, what do I do? Because I don't want to necessarily bring in a babysitter and bring exposure into our house, but we are going to have to manage this. And Gabriel's going to have to be, doing his academics and writing and all that stuff. So you're welcome, Karen. Thanks everybody for tuning in. Oh, that's a good, Karen's got a good tip. Never shop at Family Dollar, but I went there yesterday and they had plenty of toilet paper. Yeah, so that's the thing. Think about the places that most people aren't going to. Home Depot. I heard Home Depot. You can buy all these online. Home Depot, you can go online. We went on Office Depot. I've got one pack of, my Charmin, what is it? Not Charmin. I have a loyalty to toilet paper. I'm sure all of you guys are like that. Let me know if you are. I like one particular toilet paper type. And so they had it, and I bought it online, and I bought my paper towels. And so we have that coming. It's shipping tomorrow from our Office Depot. They have local pickups, but again, no need to pick up if you can get it shipped. So let's use convenience as a resource. Let's use technology as a way to connect with people. And let's just be really conscious and really smart, because it's not just ourselves we have to care about. It's not just ourselves that we are concerned for. It's everybody else. And we have a responsibility. And if you don't feel like you do, I hope this communication, you might be okay, but your family members might not, or your neighbors might not. And one transmission could equal 1,000. I mean, that's insane. And do you want that on you? No. Let's be smart and let's be cognizant of the greater whole and the greater good. Please like this video, you guys. Give me a thumbs up. For any of you new watching and you haven't subscribed, please subscribe. When the live goes on, and this, let me just do this before I sign off. If you are a subscriber and you don't get notices, because that's really big, YouTube's changed it, go to my channel, go to the little bell, hit the bell, and you can click on all notifications. You'll get a notice if I post something, some educational tip about COVID-19 on our community tab. You'll get notice when I go live. It literally blasts out to everybody. You'll get a notice when I post a new video. And I'm going to be producing a lot of content. I just really feel like, one, there's a lot of info. There's just a lot to get across. And it's part of my transmission to you. I'm not working with patients in the clinic, so I have way more time to get this done. I'm going to see, I've got to look at my schedule. I might be opening up for more virtual appointments. And if you guys feel like you need to be talked off the ledge or you want specific details, you know, I should be working my schedule on that. And then again, get this is free. This checklist, I've got a lot of good details in here, multiple pages, all online. Description box has this particular link. You can shop if you feel like, you know, you don't want to go out, and Amazon's going to be hit or miss. My full script store, that's my professional grade online store that and I've been talking with the buyers. We have shipments coming in. We are stocking at 60 to 90 days out of normal supply levels. We have Buddha teas, we've got boron, we've got all of the major high quality brands, all the regular supplements. So let's say you run out of your normal collagen powder. You can grab all of that in my full script store and you get 10% off. So it's all 10% off, no code needed. You just go in, if you set up an account. So your name and email is necessary. That's the way to get in. And honestly, I don't send emails and communication in. It's just, you get access into our store of like thousands of supplements, and there's pet care products. You can get immune boosters for your pets. Oh, Melody. Yeah, I'd love to work with Medical Medium. So at any rate, be cognizant. I really, really urge each of you to make smart decisions. It's okay to hunker, stay in place, deep breaths. Let's do some yoga exercises. Let's clear our mind. Let's get focused on what's important, in our health and safety is of utmost importance and priority. So with that, friends, thank you all. This has been so great. I did not expect to go on 2 hours and like 16 minutes ago. Holy cow. I can't even imagine how many of you all have been on. And if you were on for the whole time, thank you for making time. And so plan on 9 a.m. It'll be like a little natural health news. That might be a new series, just very impromptu. And honestly, if I can make it work, I might be flipping these into audio files and then doing like natural health news or something like that in podcast settings. So stay tuned. A lot going on behind the scenes. I have cleared out a major energy drain being the wedding. And so I'll, just for kicks and giggles, I'll show you guys my invite. Look how pretty our invites were. So I'm going to use the same ones. These were our little envelopes. Pretty, huh? And it came with the little RSVP. Those pretty in the blush tone. So navy and blush are my colors. And if you guys want to follow a whole bunch of my content I'm going to be putting out, I started a new YouTube channel called the Wedding Channel. And I am going to detail all of it. So I actually shot a video. I'm going to call it Coronavirus Ruined My Wedding. I can only laugh because if I don't, I break out crying and it's not good. But yeah, so these were my little invites, and I kind of wrapped these and put them in this beautiful envelope. So we'll do it again, as is nothing. Everything's changing, everything's mobile, everything's fluid. We just have to go with the flow. As much as it sometimes hurts, we just got to go with it. So let's go with the flow. Friends, there are going to be aspects we're not in control of. There are going to be aspects that we're going to feel like there's an unknown, and it's okay. This is normal. We're in it together. I don't want any of you to think that you're alone out there. If you are in quarantine, if you are stuck in a nursing home or a facility where you don't have access, you're not alone. This community here, we are here for each other. And I just want you guys to know that I will be doing what I can to keep us in this communal setting. I'm just going to encourage each of us to support each other and, comment on each other's comments. And again, like this video, it's going to get wrapped up. It's going to go out onto my actual channel. Please come back and comment on it. That does help engage each other. But also, we're just going to have to take this as it comes. And I hope to be a resource and a leader in your world in the healthcare setting. So thank you for blessing me with that opportunity. And I will see you guys probably tomorrow, if not earlier in video. So I will be putting out a wedding channel video later on today. So stay tuned for that on the wedding channel. And I'll post that link in the description after. So thanks, friends. I'm so grateful, Lorianne, Lonnie, C. Luna, Crystal, Sally, all of you for tuning in and staying on. I'm grateful. Thumbs up. Please share this video. And I hope you guys are safe and well. Be safe and well. Make smart choices. I'll see you guys later.